Ready? All right, good morning, everyone. Welcome to the Health Services Committee meeting minutes. First order of business is to approve last month's committee meeting minutes. Motion made by Supervisor Frazier, seconded by Supervisor Westcott. Oh, I'm sorry. Supervisor Conover. All in favor?
Aye.
Opposed? Carried. Okay, Pat, take it away.
Thank you. Good morning, everybody.
Morning.
First thing on our action agenda would be to request a resolution to authorize a contract agreement with Debbie Way to provide respiratory therapy services in a form approved by the county attorney. The respiratory therapist that we currently have is out ill and will probably not be returning, so we need to, because it's on our operating certificate, we need to get a new person.
Okay, motion made by Supervisor Conover, seconded by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried.
We would also like to request a resolution to renew our contract with the State Department of Health to allow continued receipt of funding for our Children with Special Health Care Needs program for the contract, which started on October 1st in the amount of $18,419. We get this every year. Every year they kind of send it out when the funds are available, and as long as it's money to us, we take it when it comes.
You can always ask for more, right?
Sure.
Okay, motion made by Supervisor Frazier, seconded by Supervisor Conover. All in favor?
Aye.
Opposed? Carried. Okay.
We'd also like to request a resolution to authorize the chairman of the board to sign the HIPAA Business Associates agreements with Adirondack Health Institute, which is the lead agency for the district for our area, which is Adirondack Health Institute, in a form approved by the county attorney. I did ask Mr. Apperdew to look over this agreement, and he was going to come this morning, but I just called his office and he was on a conference call. He said he wouldn't hold up the signing, but he was concerned because it was just sent out by the state, and it didn't hold the county harmless, it only held the state harmless. But there's really nothing that we can do about it, and Martin agreed with that. We have to just go with it, but he was going to come if he was able, and I guess he's not able.
Okay, we're good with this one?
I haven't spoken to Martin, so,
okay.
Pat, you're saying Martin said it was okay at this point?
He did look at it. That was his only concern. And we always put the little proviso in it that it's in a form approved by the county attorney, so he does have the option to add in whatever he would like. And I called up Adirondack Health Institute, and I spoke to their staff person, and he said they basically just turned around the agreement the way it came from the state, because that's what they were required to do.
Okay, very good. Okay, motion made by Supervisor
Yes,
Conover.
subject to the county attorney's review and approval.
Okay, that's fine. Seconded by Supervisor Frazier. Any more discussion? All in favor?
Aye.
Opposed? Carried. Okay.
That form approved by the county attorney all the time. It's a good cut, and that it works. We would also like to request a resolution to authorize an agreement with Mariel Inc. to allow for the purchase of vaccine that we use for our animal vaccinations at our rabies clinics in a form approved by the county attorney. This is the same company that we've been purchasing our rabies vaccine since we've been holding rabies clinics. But recently we learned that we would be able to get the vaccine at basically half the price. It was $143 a dose. With the new contract, and right now it's like $286 a dose, even though once in a while they fluctuate. So this is another one I also had the county attorney look at, and he drafted an amendment that he wanted us to add to that contract. And Janelle has, when she was getting the quote, she did send it to Muriel, and they've kicked it to higher up. But we would like to have the rationale, because the resolution, because it does allow us to save money.
Very good. Motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Would you like to request a resolution to authorize a contract with the State Department of Health to allow acceptance of funding for Ebola preparedness and response activities in the amount of $38,000 for an 18-month contract period in the form approved by the county attorneys. Federal funding has been released for all local health departments, and even though it doesn't appear that there's much action on this front, if we don't accept the money, we're still going to be tasked with doing a lot of the deliverables anyway, so it would behoove us to take the money.
Okay, motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Moving on, we'd like to request a resolution to authorize a participating provider agreement with Prime Health Choice LLC to allow for, health services and receiving reimbursement. This is another managed long-term care plan that's going to be offered to, Warren County residents, and so in order for us to accept referrals of these people, we need to have a contract.
Motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor?
Aye.
Opposed? Carried.
Moving on, we, would like to, request committee approval to allow Sandy Watson of Ed Paquette to go to the 37th annual conference sponsored by the WIC Association. It's in Lake Placid this year. Unfortunately, in past years, it's been in Albany, and we've been able to, just have everybody go, but this year, because there's lodging involved, just 2 people, will be able to go. It is fully funded, by the WIC program grant, so there's.
Motion made by Supervisor Conover, seconded by Supervisor Frazier. All in favor? Opposed? Carried.
The next one is a request of committee approval to backfill a nursing position for which approval was already granted in July of 2014. And, silly me, I looked at the form because I had everything, all the i's were dotted and t's were crossed, so I called Joan and I said, because the form has now been tweaked and it's a little bit different than the form we had in July, even though the money's in the budget and everything is the same, do I need to do anything different? And so, she advised that we, redo the form and go through the procedure, which I did. I talked to Gretchen, she signed off on it. I talked to Paul yesterday and went through the usual grilling process. And, I think right now, I believe he is on board with it. So everything is in order, the money's there, and we have 2 nurses that are gonna be retiring later in the year. And so we can't, we have to start to recruit now and get them oriented, so when the first one retires in the summer, which is the middle of vacation season, we gotta have somebody ready to go. So we won't have people do the referrals.
Okay. Motion made by Supervisor Conover, seconded by Supervisor Frazier. Any discussion? All in favor?
Aye.
Opposed? Carried.
We have no pending items this month. Moving on to information for discussion and review, you'll see the, copy of the monthly activities for emergency response and preparedness. We're getting ready to do our ClinOps, to get ready to do the drill at Town of Queensbury with the,
March 12th from 4 to 6, and we're aiming for 500 participants to flip through our clinic. And we have to show 10% of special needs population, which includes children, elderly, and other groups that we've reached out to help with our planning. And if you could maybe help us spread the word, we need any and all to come to our clinic. Dan Durkee's done a great job with his organization to date, so there's information on the website.
regarding status of referrals, if you want to look at attachment number 4 for the detailed report. Sharon, do you have comments on that?
We're, holding our own, and we're the same as we were last year. Our overall referrals are up in numbers, so we're competing quite well against our competitors. And we're still the preferred, I'm glad to say, the preferred agency for residential Warren County Health Services.
Excellent.
When they're in the acute care centers, they, the regulation, state regulation is they have to be offered, the client has to be offered a list of agencies. And of course, because of our reputation since 1966, and most of the people have always had us, they would prefer to have us back. So that's an excellent, reputation to uphold. And some of our competitors are questioning that, and making sure that the hospital is doing as, our local hospital is doing as they're supposed to, which they do. Irene Gray is the, coordinator for that department, and it is done on a fair basis, for sure. So, we still have our 2 liaisons that represent us at Glencoe, which is very helpful in coordinating the referrals.
Regarding last month, we talked about, our state health department survey follow-up, and we got a form sent to us, scared us because it was a form that, they sent to everybody. We have submitted our plan of correction, and, Sharon has been advised on the phone that it's fine, but they haven't posted it yet on the HIN, so as soon as that happens.
Well, we won't be posted on HIN because we're in the old the computer wasn't updated at the proper time, so. I spoke with Lori Novak, who is our state reviewer, and she called me on February 19th and said the recertification plan that I had sent, which is a new process this time. And this is why you guys have never heard of the recertification plan, because there never was one prior to this new certification process. So she said everything looked fine. She wanted me to make two corrections. One was to say, we have a report that we run for home health aid PCA supervision. And when I said the report would be run every Monday and we would audit and we'd have 100% compliance, she wanted me to add the word all patients receiving health aid. A report is a report. I didn't say that to her. And there was another thing she wanted me to add, which I sent her on February 19th. She said everything looked good. I haven't gotten the formal letter back. But I'm sure if we had any problems that we wouldn't be providing service, nor would we be able to bill Medicare.
Right.
And the form that was sent to us is a standard form that goes out to everybody.
Paul, did you wanna make a comment?
Well, thank you, Mr. Chairman. Just when Pat was mentioning the reputation of Warren County, which, certainly I 100% agree with. I know your agency has a great reputation in the community for caring or providing nursing services. And I know that we put out some brochures. Of course, we've now got the logo on the cars, which I think is good. And while we're together, and maybe just to throw this out to the committee members, what just bounced into my head was I wonder if we shouldn't take an ad once in a while out in our newspapers, just to get our name out there again. I know that, well, Don's not here right now, but Tom is. I know that Tom will give some coverage in the news article, but maybe we ought to, in the different newspapers, just getting the word out that we're, making sure people keep an awareness, because sometimes I think that people might think that we're a government agency and maybe yes, maybe no in business, but this is really a business enterprise, and I think we need to get that message out a little bit more. So I just throw that out there if you wouldn't mind spending some money in that area.
Is that $4,000 for Clinton Falls Hospital to get a whole page ad on the back of their
On the inside, we got the inside cover this year.
So, and we did it last year, and it really did pay dividends, because everybody that goes in there, no matter what treatment they get a copy of that.
But
I'm thinking of the local newspapers,
But I
the
do-
Post-Star, the Denton Publications, the
And
Chronicle.
I do think that that's an excellent idea, because we do hear stories sometime where people will say, because you can't control everything, oh, I didn't know you were still in business, because there are some hospitals in Albany area that are just kind of overpassing. And without particularly having the incident and the patient's name, I can't go back and track that. So I think that is an excellent idea, to do it on a regular basis. We're here, we're in business, and this is the service we provide. Especially our North Country people. In North Creek, I have to mention, people are specifically, and Dr. Way is also involved, specifically asking for a particular one of our nurses, and I'll be glad to mention her name here. It's Kathy McGowan. She's a Florence Nightingale in North Creek, I'll tell you. So, even if we could feature maybe some of our staff members or
Another idea,
Yeah.
right.
for it.
I like that.
No,
Supervisor
I think it's a
McDougall?
great idea, Paul, and I certainly would, support that, and that, we live in a competitive world, and, just trying to make sure that, the consumer out there understands that, we're in the game, we're out there kicking, we provide quality care, and, we have, does Washington County provide this service still, or?
Washington County does not have a certified home care agency. What they have, our competitors in Warren County are HCR, which is offices located in Washington County, and Fort Hudson also has a certified license to provide service in Warren County, and we have 3 other competitors.
And again, I think name identification is important, the logos on the automobiles, I notice them now, and bingo, so it's all part of, I guess, marketing 101, I would think. So I don't know what we need to do to kinda,
Well, I think we leave it up to Pat right now as far as how much,
I think it's a work in progress.
Yeah.
Every time we see some kind of an opportunity, we really try to seize on it, and I think our mindset now is different than it was, obviously, several years ago.
Matter of fact, we're doing a fair this afternoon from Adirondack, from 2 to 7 or 6, with one of our liaisons is representing Warren County Health Services for the Home Care Division and the Public Health.
Mr. Chairman,
Supervisor Connell?
I look forward to hearing and seeing you in those commercials.
I think I'm out there enough.
We talked last month about the, animal control situation that we're in the process of working through some of the concerns before the big, busy season starts, and we are, not totally final with that, but we're a little ahead of the game than we were last month, so we'll keep you apprised with that. And Todd, tell them about what they're here to hear.
Attachment 2 is the current status of still 2014, which is not closed yet. Didn't really change much since we met last month. I just wanted to give it to you because some little things here or there. Again, just to remind everyone, on the expense end, we're still waiting for our WIC food vouchers, which we get from the state, and we were notified we won't get those final numbers till April, which I let Mr. Lynch know, and he was fine with that. And our early intervention accruals that the state again is paying, and I have to get information from them again, and so I'm estimating about $1 million may be added to the expense line. And regarding the revenue line, again, our preschool program, we will bill coming up in March or April. Our WIC program, again, regarding the food vouchers and our early intervention revenues related to those expenses, that could be $1.5 to $2 million more in revenue. So, even though the numbers look, like I said, it's skewed a little bit from budget or last year, we are expecting over $1 million in both categories to be added to that. Attachment 2A, now we get into 2015, and that'll give you as of the 24th where our status was, and you'll see regarding payroll again where we look at, we are down overall again by $31,000 compared to last year, and also that we are 10.24% of the budget at this time, where last year at this time we were 11.56. I did know, again, when we do have someone who retires and if it is a big cash out, we did have someone last January, so those numbers are still within 2014 numbers, and it skews it a little bit, but we still remain below last year regarding to all total salaries. And attachment 3, which is our comparison from last year at this time to as of the 24th when I printed this. Again, you'll see the comparison in most of the expenses. Again, salaries where we're down, and expenses were down, and right now some benefits. The big thing that is a big comparison is the revenues, and primarily that's because we closed January and $414,000 or so was in there is what we were able to bill for January for our long-term care, our CHA, and our MCH program. And so I've included that, and last year at this time we hadn't had that closed yet, so that's why you're seeing that comparison. But otherwise, again, it's a good report. It shows you exactly where we stood last year at this time.
Conover report.
No, it's an excellent, they do an excellent job.
Supervisor
just
McDevitt?
one quick observation. Ed and I were talking about this morning, but there was an article I was reading online this morning, and it had to do with the Queensbury school system and poverty in our area. And it was an interesting perspective from, it talked about 800 kids within the Queensbury school system that are on a special allocation as far as food is concerned. And it talked about I guess you might describe it as the very, the very negative implications of poverty in our society. And it mentioned kind of a buzzy word that I thought was interesting. It talked of a 3 million word gap, the gap of words that young children hear by the time they enter kindergarten. And they were talking about the 3 million gap that some kids don't hear by the time they reach kindergarten, which is somewhat a function of poverty and family issues. And it just, here we sit in our very backyard, but poverty's an issue. 3 million words for a young kid going into kindergarten lacking that because they don't have the interaction, socially, is a problem.
Used to be with the free and reduced lunch situation, that we always knew there were children that would qualify if they would just fill out the applications. And I think as time has gone on, they've got a way so that all the kids don't know who's on the free and reduced lunches, and that's gone, I think, a huge way to getting people that really need to have ability to have that happen.
Yeah,
Which
so you're,
sounds like a no-brainer, and it was a long time ago.
yeah, so you're automatically tagged as a second-class citizen,
Yeah,
you know,
that
by
that
how
I
you, how you
think
eat, huh?
doesn't happen
Yeah,
anymore.
yeah, good.
Okay, any other questions or comments for public health?
There's a copy of the fourth quarter of our rabies report as well for you. And if nobody has questions, that's all I have for you today.
Supervisor Conover?
Yeah, I just wanted to mention, I just looked up and I see our good friend, former colleague, Mr. Strainer here. Welcome, Dave. I know, you,
They're always busy.
wow, it's good to see you.
Okay, if not, we have, Mr. York from Mental Health up next.
Thank you.
Thank you.
Thank you, ladies.
If I sit up here?
More than welcome.
Sit up here, Ralph.
Do you know Mr. McDevitt?
I do.
Thank you very much.
Thank you.
Went to the county Democratic meeting Wednesday night at Fort William Henry.
Oh, really?
Cleveland,
Think you think he's running again?
Oh, yeah, he's running, he was talking.
Shocked to hear that,
I am
really.
too, I am too.
That'll
whatever.
be an interesting race, won't it?
Great to watch. As long as I don't have to be part of it.
Yeah, I was really surprised when I heard that
He's
yesterday.
got some issues, he said, we'll bring up.
But I'm sure Bud had issues when he
I'm
went in.
sure he did, I'm sure he did.
It's that
I'm
same old story.
Sure he did, yep, yep.
All right, Rob, we're ready when you are.
Okay, I just have several resolution requests here for budget amendments to 2015 for several of our contract agencies. This is related to a 2% cost of living adjustment that was put into the current year budget by New York State that's specifically for direct care workers that, you know, directly work with individuals with disabilities, providing care for them. And so this is 100% state aid. Some of it comes through our Office of Mental Health, and some comes through the Office for Alcoholism and Substance Abuse Services. But in either case, it's 100% state aid. And this is the breakdown for the various agencies here. I did put together resolution requests, you know, separate, specific to each agency, but those are the amounts. Do you want me to go one by one?
You know, if it's okay with the committee, I'm thinking we could almost go 1 through 6 and approve it that way.
That'd be great, yeah.
Okay, motion made by Supervisor McDevitt, second by Supervisor Frazier. All in favor?
Thank
Aye.
you. Yeah.
Opposed? Carried. Okay.
Okay, thank you very much. Number 7, and then we'll jump to that, and that's a request to approve a resolution authorizing execution of a business associates agreement with Adirondack Health Institute. This is really the same agreement that Pat was talking about in signing with Adirondack Health Institute as part of the district planning process. So our office is also involved in that. We would want to sign this to agree, you know, for protected health information, secure it in a certain way, agreeing not to share it, you know, beyond the legal bounds, so.
Just that, I would so move, I'd make a
Motion made by Supervisor McDevitt, second by Supervisor Frazier.
I just had a comment.
My
I
committee's
see
dwindling.
Liberty House mentioned here, and I you know, would have to speak very, very highly of that organization. They are in downtown Glens Falls, in the Methodist Church structure over there, and they just do a remarkable job in terms of trying to get people that are a little bit challenged out into the marketplace, out into the employment area, and it's what is the young lady that manages that program,
Julie Beebe.
Julie, just does a wonderful job, so great program.
I would agree, thank you for those comments.
Excellent. Okay, we have a motion and a second. All in favor? Opposed? Carried. Okay, anything else, Rob?
That's really all I had.
Thank you for showing up, Mr. Conover. Appreciate all your comments and questions.
Chairman, it's always a pleasure.
Okay, anything else for Rob or for the health services? If not, motion to adjourn. Motion made by Supervisor Devitt, second by Supervisor Frazier. Favor?
Sweet.
Thank you.
Complain about that, Ron, just didn't get back here in time.
Just got back to the